vertebrates should I see?
All 7.
Nope.
Oh, it
See,
says on
it's-
7. C3 to 3 to 7.
3 to 7. Okay, 1 and 2, a lot of times you don't see because of either the mandible or the occipital bone. Usually the mandible. Okay, so let's go over this one first. So here's the, here's T1 here because we can see the last rib. So that's 7, 6, 5, 4, 3, a little bit of 2, not a whole lot. I can even see the odontoid here. And the spaces, which are what? You guys have a brain fart with this.
With the feet?
No,
Intervertebral.
no. Apophyseal joint. Okay, remember C1, C2 apophyseal joints. You can see it in an AP. Okay, so this is the apophyseal joint of C1, C2. Okay,
The only one you can see it.
all right. So what are these?
Oh, the line.
Spinous processes, and if there was no rotation, what do you look for?
Like equidistant.
Yeah, they're equidistant. Okay.
Oh, from
A lot of times
pedicles.
you can see pedicles. Okay. We don't really see open, and I don't know, maybe this is an older person. We don't really see open intervertebral disc space. I don't know if they did an angle or what, but they're not very open. So let's look over here. This one's good. We see 7 through 3. Okay. What about this one? If you were to critique it,
Bring the chin up.
okay. We don't see 7 through 3. So here's this is T1 here. 7, 6, 5, 4. And we got all that jumbled up. Good. So the chin's in the way. This is the chin. This is the mandible here. See the gonian, also known as angle here. What's this then?
Occipital.
Okay. Occipital bone. You can see the mastoid processes here. Those are really huge over there.
Look at yours first.
Yeah.
Why do they look like they're like porous?
Because they have little foramina in them. Your mastoid hair cells, they call them. But yeah, some people have a whole bunch and they're really big mastoid hair cells, and some people don't. So it's cool. Different. A lot of little kids, they used to. There was a procedure called mastoids. We used to do mastoids, and if they ever brought little kids in, we were like, why would they do that? Because kids, they're not aerated. So we'd have to say, you know, instead of irradiating a kid, we'd say, can you call the doctor and say, you're not gonna see, I mean, you hate to tell a doctor, you know, that they're stupid, but anyway.
It's like, why'd you order this?
Yeah, why'd you order this? They're closed up anyway. They're not aerated, and kids, you know, used to give them all the time at Memorial. Once in a while, take the chance.
Punch you in the jaw, that's why it knocks you out. Yeah.
I thought it was just like
No,
hit
you're
your brain or
a
something.
foreigner. All the nerve patients.
I was like a sinus cavity at first. Freaks out of nuts.
You don't really see study dogs on cervicals, right?
No.
Okay.
mainly lumbar. All right, so these are obliques, or what's supposed to be obliques. And like Masako said, we should see the intervertebral foramen on which side? Remote side. So, remote means the side furthest away. So what position, here's the right marker, so what position is that? It's an RPO. Just look at the way that the face is facing. Okay, so you know that it's an RPO. Do I know that it's not an LAO? No? I mean, because that would look exactly the same. The marker would be flipped around, however, but RPOs look exactly like LAOs when you put the image up. Okay, so let's just say it's an RPO. So here's the intervertebral foramen here.
On the left side.
Good. So that would be the left intervertebral foramen. Okay. All right. TLC, RAR, AAI. All right. So it's this one.
LPO.
That's an LPO, opening up which intervertebral foramen?
You're right.
The right side, okay, which is the remote. What makes up an intervertebral foramen?
The superior and inferior notch.
Superior notch of one vertebrae with the inferior notch, vertebral notch of another vertebrae. What goes through the intervertebral foramen? Nerves and vessels. Okay. All right. What makes up the vertebral foramen?
The body and the arch.
Good. What part of the body?
Posterior.
Posterior aspect of the body with the vertebral arch. What makes up the I'm testing you ahead of time. What makes up the vertebral arch?
The pedicle and the lamina.
2 pedicles and 2 lamina. All right. Good. Did you say what goes through the vertebral foramen?
The spine cord and meninges.
Spinal cord and meninges that surround it. All right. How many vertebrae should you see on the obliques?
Say 7.
All 7. You should see all 7.
And T1. To be able to count, right?
Yeah, most of them, yeah. On all of them, they really like to see T1. So here's T1 with the first rib here.
Question.
7, 6, 5, 4, 3, 2. So, what would you, if you went back and did that, with this jumbly stuff going on, what would you go back and do?
Angle?
Angle would be one thing. What else?
Do you tilt their head forward? No.
The other thing.
Oh yeah, then that'll mess it up. Wait, you go up?
See the mandibles in the way. So I would have them jut the chin out just a little bit because we get this mandible here. This is C1 here, so we can still kind of see it, just not very well.
Well, if you bring it 2 up, wouldn't the occipital bone that's showing right there get in the way?
It would get on that posterior arch.
Right.
Yeah. So maybe
Like an oblique.
jut the chin out.
Could you do that on a page? Would it get a bigger picture? Yeah?
If you could.
I have a question. So when you say the first rib, this?
Yep.
And then what is this the clavicle and the first rib
Nope.
or and 2 ribs over there?
No,
Why
that's
is
the
that?
second rib.
What is? Oh, second rib. Okay. I thought it was a rib that was cracked. No? Okay. So it's 2 ribs, just super.
Yeah. It's just the way that one's kind of spread out versus this one.
Okay.
That's what you're looking at.
Oblique is weird. It's hard to tell what's what.
They
on the
are
ribs
kind
and
of
stuff.
weird, aren't they? Because you can see one clavicle here, the other clavicle here. Kind of messes everything up. Sternum, you can see a little bit. Okay, so we said this is an LPO opening up the right intervertebral foramen. If you were to critique these 2, what would you say? They're a little dark. So what do we call that? Too much what?
KVP.
Contrast. It's
Low
overexposed.
Overexposed, or too much receptor exposure is what they use now, not too much density. They take the density away. So these have a lot of receptor exposure. Now this is a good one. This is really good. See how we can see up here, we had the same issue with the chin kind of getting in the way. This one, the chin's not, the mandible's not in the way. We can see C1 really well. C2, 3, 4, 5, 6, C7 here, and T1 is there. So that's pretty good. That's a good one.
Can you show T1 again? Sorry.
T1 is here.
So the one.
2, 3, 4, 5, 6, C7 is here. So T1 is this one coming up.
Oh, okay. Curves.
It doesn't show all of the spinous process on the back.
Yeah, this one's easy.
7.
Yeah, see,
Oh, yeah.
good point.
It's like barely there.
See the vertebral prominence here, how long it is?
It's dark.
Good point. All right, over here. What's that? It's a pretty one too.
Alright.
What position?
Should have been RPO.
Yeah, that's another RPO. Not really seeing. This looks like C1 up in here. 4, yeah, hello. 4, 5, 6, C7. And there's T1 here. That's a good one. You see we can count from 1 all the way down. 2, 3, 4, 5, 6, 7, and T1 is here. Now, if you were to critique that, what would you say?
Not enough penetration.
As far as positioning?
Oh. Chin up.
I can put the chin up a little bit. What else? Is that a good oblique?
No, it's not rotated enough.
So is it too lateral or too AP?
Lateral.
You can see like the gaps
Good.
between
So this is too lateral. We're starting to see apophyseal joints. Remember we see apophyseal joints in the C-spine on the lateral projection. So this is too much, too many. What about the next one? Same thing. Okay, it's too lateral.
Looking for this one.
Yeah, that's coming up. Thanks. All right, so here's some of our laterals that we have. How many cervical vertebrae should you see? You should see all 7 on the lateral. And like I said, if you don't see C7, what should you do?
The swimmers.
Swimmers. Wow, this one, I just noticed this. They must have had some kind of surgery back in here.
To remove the
spinous
spinous.
Yeah, so they had some laminectomies or something, some kind of surgery.
That help like range of motion because it doesn't get in the way. But wouldn't that allow subluxation in the back too?
I have no idea. Of course, I didn't write down the history.
Do they have teeth?
No teeth.
No teeth.
Dentures.
It is a very old
Old
person.
Yeah, and it looks like they approached anteriorly. I don't know.
They had surgery. They have staples.
Yeah. I don't know. I didn't write it down.
Probably post surgery, right?
On it. Yeah.
I'm missing a lot of stuff.
All right. So, do we see all 7 cervical vertebrae?
What
Six, five.
is
Yes,
left
we
is
do.
right.
Yes, we do. Here's 7, big long spinous process, 7, 6, 5, 4, 3, 2. Remember, we can see. Good thing you left that one on.
Yeah.
It's the thickest from top to bottom.
C2 axis.
And C1. Registry question. Besides the Fuchs and the open mouth odontoid, the other way you can see the odontoid process well is in a lateral projection. You just see a lateral view of it. See it coming up here, the adductory process. See here. Alright, so this one's good. We have all the spinous processes on here. Here's C1, ring-like, C2 with that big odontoid, 3, 4, 5, 6, C7. It's here. We've got T1.
We got T1 too.
What are these?
The gown buttons.
The buttons or snaps on the gowns. Okay, what's wrong here?
Overexposure.
Okay, so it's too much receptor exposure, yes, what else?
The nail.
Rotated.
Yeah, it is rotated, it's not a good lateral.
Yeah.
What is that?
Not overexposed because
I have no idea what
because
that,
that looks whiter.
I don't know if it's one of those. I don't know what that is, because that might be,
Hearing?
it could be one of those plugs or whatever you
Yeah.
call them.
A hearing aid? No, it's too.
That would be, that's
Yeah.
too low, but could be a little, because it looks like a little bit too oblique, so that might be some kind of earring. Oh, I see another one. I know. That's weird looking. I don't know what that is.
Sorry to go back. What is this thing?
What do you think? What do you guys think that is?
It's a highway.
Oh, wait, yeah.
Pilot phone.
Let's see, connected from far.
All right, so the lateral cervical opens up what? What does it demonstrate?
No, that's-
The what?
CR.
Okay, we see intervertebral disc spaces,
Apophyseal.
and we see the apophyseal joint. Which apophyseal joint is it?
The right.
That's a trick question.
Oh.
It goes all the way through. Right, so you see them through and through, the apophyseal joints. Okay. See the little lip on the bodies? That's why we sometimes angle on the obliques and always angle on the AP, because of their downward slant. Okay. What's wrong with that one?
Earrings.
Earrings, zipper of some kind or another is there.
Could that be a neck brace? Or no?
No.
No?
Could
Okay.
be. So 1, 2, 3, 4, 5, 6. Oh, C7 and T1. We see that too.
What is it for a hair tie? Is it like a hair clip?
Oh, yeah. Yeah, you're right. That could be. That's exactly what it is. Who said that? Good job.
Come on, you get your hair every day.
Oh,
We could use some collimation here. Okay. All right, put them off the duntoid. Okay, let's start with this one.
You kind of see the space.
Okay.
And
What
the
do we don't say space.
oh,
What is-
apophyseal.
We see the apophyseal joint, AKA out there, space. See the spaces? Yeah, so we see the apophyseal joint of which
C1, C2.
C1, C2 apophyseal joint. So we can see it with the AP, okay, not the lateral on C1, C2. So we see the apophyseal joint, but what don't we see? Well,
Odontoid.
we don't see the odontoid process. What's in the way?
The teeth.
Good. The teeth are in the way.
So bring
What
it
would
up.
Good. So you would go back and bring their chin up a little bit on this one. Does everybody see that? about this one?
Both the seal joints are okay, but
Okay, we got apophyseal joints.
the
Occipital,
Okay. The occipital bone is kind of in the way. Just a little bit on the tip.
bring
Because
it
here's
down.
the teeth here. They just didn't open their mouth wide enough.
Oh.
Because here's the teeth here. There would be nothing, if we couldn't get that person to open their mouth wider, there's nothing we could do. We would have to go to a Fuchs to get the tip. Okay. Because everything's so close. You can see the lateral masses of C1 here. Kind of cool. You can see the anterior arch of C1 on this one.
Oh.
What about this one?
Occipital.
Good. The occipital bone is in the way. So what do you do?
Down.
down.
Just have them put their chin down a little bit.
That's pretty.
That one's pretty good. I don't think you can get much better than that. Very see-through bones. So what does that mean? If there's osteopenia or osteoporosis, when they're real see-through like that, means that they've just lost a lot of calcium. So here's two Fuchs. As you can see, you don't see apophyseal joints on the Fuchs. It's only for the odontoid tip or process. This one, I don't know. It doesn't even look like it looks like they manually did collimation after they shot it. That's horrible. Gosh.
Doing a straight line.
Yeah. It's like an unportable line. It goes.
So what happens with the Fuchs, the chin's way up like that, mentomeatal line is perpendicular. You see the odontoid process or dens circling the foramen magnum. So that's the foramen magnum here, which is the big hole that enters your skull, and we haven't gone over it yet.
Question. There was something that an X-ray tech said that the hard palate was getting in the way of the odontoid, and then he had to do a few. Is that something?
So he was saying the teeth,
I guess. I don't know.
or did the person not have any teeth and just
No,
the
he
palate?
didn't.
He did. That's what he meant. The
Oh,
teeth.
okay. The teeth. Okay.
Yeah, the hard palate, the palate of your mouth.
But if your teeth are in the way, just bring it up, right?
Correct.
So he could have repeated it.
Right, but he just went directly to Fuchs. Maybe the occipital bone and the teeth were so close that he didn't think that
Oh, okay.
something. Sometimes there's nothing you can do but just do a Fuchs.
So that's an AP, like,
Yes.
you go up. Okay.
There is the Judd. No one ever does it, but that's a PA.
Do you still go like this, or do you do the opposite?
No, you still go like this except your PA.
Okay.
But wouldn't the Fuchs be less OID than the PA true
That's what I was
waters?
just thinking.
It would.
So would you prefer
The Fuchs?
A? Yeah.
Oh, definitely.
Okay.
But you know, we teach everything, just
Well, it's called true water, so it sounds better.
no. If you're doing a waters, you're doing it mainly for facial bones and sinuses. So the PA is better because it puts it closer.
Okay.
I can show this stuff all day, but I know you guys kind of test me. So some of this stuff is feeding you. Yeah. Ooh, yeah. Just if, and I have so many of these. Some of these are really sad. Okay.
It's like a decapitated person.
Yeah. So, but this one, what do we call this kind of?
Subluxation.
Compression fracture. This is a compression fracture where there's a collapse of the vertebral body. I don't really see a whole lot of subluxation, a little bit of subluxation. But anyway. This one is, what do we call that?
Dislocation.
That's a dislocation. And I don't have the history, I don't remember with that person, but that's pretty bad. I believe from T1 up, if it's dislocated like that, they're a quadriplegic. Yeah, and if injury occurs from T1 down, they're a paraplegic. Yeah. So, and we don't know the history. This one I do know the history. This is really gross. I don't know what to tell you.
Yeah, we do.
You want to hear it?
Yeah.
All right. So this happened. This person was on Davis Island, and someone found her. You know, they have the bridge, you know, all along the shoreline or whatever you call it on Davis Island. But right behind Tampa General, there's that big that bridge. Well, someone found her behind there. She was still kind of alive, but somehow they knew, whatever, that she was a prostitute. And the paramedics, when they found her, they kept trying to intubate her, and they couldn't intubate her because they didn't know that she was. So they brought her into Tampa General, and anyway, she died. They think she was murdered, but this was a long time ago. And the thing that's really sick about it, I hate to say it because sometimes medical people are really cruel. They called her Pez.
Like candy dispensary thing. Oh my god.
Isn't that awful?
It's so hard to say.
Why?
Like, why?
I don't see
You know what a Pez? You know what those Pez things are?
Oh, the thing that you can clip. It's like a rectangular candy that comes out.
Yeah.
Oh
Isn't
my
that awful?
Like was she like cut when they found her, or it was?
No, she
Like
wasn't cut.
snapped.
It was just snapped.
Oh my god.
And, you know, obviously they didn't know that it was snapped. See how they tried to go in here first? And then I guess they went in this way? That's her hyoid bone connecting stuff.
It's gone.
It says port? Is that portable? Oh, they used to write on there when it didn't portable. Yeah, that was sad. Oof. Oh. I need to cover up this. I'm standing in your way, Shane.
Oh, C1, C2, and C3. Wait a minute, the teeth?
Oh, I'll show you. It's a hangman's fracture.
Oh.
So, it was a car accident. I don't know if you guys, at Tampa, I get all these from Tampa General, that's where all the gross stuff happens. But anyway, if you like trauma and you like this kind of stuff, Tampa General is your place. Because they get a lot of this. And this was, I don't know if you guys know Mike Muschetto at Tampa General. Any of you guys? He's still there. He does CTs. Anyway, he gave me this. So this was a hangman's fracture that he wrote down here. It was a car accident. I don't know what happened afterwards, but you can see right here. It's disconnected. C1, C2. Obviously, they would need to take another one because they missed the spinous process of C2.
It's the like thing hanging in front of his face.
It looks like some kind of tubing. I don't know for sure what that is. Oh, that's the same one.
Is it quick today? No, it's Thursday.
This is an interesting one. not sure why he came in. He obviously had a neck ache or something. So they did a C-spine and they sent him home. So that's the initial.
All this looks.
He's a little oblique,
Oh, okay.
but it is a lateral, or supposedly a lateral. You guys see anything?
What's that
In
hole?
the C6.
No.
What was
So
the
here's
complaint?
two, neck ache.
One,
Okay.
So here's two here, because we can see the big spinous process, 3, 4, 5, 6, 7.
uh-huh.
7 like broke off.
Oh yeah, the spinous process.
Yeah, you guys see that?
Yeah.
They missed it. On the first go around, they sent him home. And he came back and said something's still wrong. So they reshot it. Yep. There it is.
Nice and broken.
Golly.
Yeah. Still.
Isn't that like a lawsuit right there? Like, holy crap.
And it says, okay, it says this was in the ER. So he went to the ER, obviously, with neck pain. When he came back, he went to routines, and they shot that in routines. Those of you that are at Tinker General, there's a big difference between ER and routines. So
Do you
So
think
he-
the ER would be better about making sure they get that? Yeah. Did you ever know why he broke it? Like,
No, I didn't.
oh yeah.
It's hair everywhere. What's the higher one in front? Where the C3 is kind of weird. Under C2.
Okay, so here's one, the ring.
Uh-huh.
Here's 2. Here's 3, 4, 5, 6. We don't even see C7.
Yeah. What's the bulge in front of
Oh,
C?
on C5, the tip is.
Good. What do we call
Oh.
that?
Ablation.
Good, an avulsion fracture, specifically
Jefferson.
teardrop. So a little teardrop fracture. All right, one more, and then I'll let y'all go. I think that was so good to this whole day. So what are those two projections?
The right one is Fuchs.
Open mouth odontoid and Fuchs. A little dark, but anyway, they're copied. Someone copied them for me. See anything?
It's split.
Deltoid has a fracture.
Odontoid split.
So the odontoid process is split right there. Couldn't see it here, it was too dark. So they did a Fuchs and a fracture there. All right, I'll let you guys go.
How would you fracture that like that?
On your head.
Could be a smash, it could be similar to Hangman's kind of hyperflexion or hyperextension.
You totally made a feature.